following video has been provided of a basic use of how to fit a standard sling design from a seated position, in this case an armchair as shown. Please note that a general assessment must be conducted in all instances by a qualified carer or clinician in order to ascertain the correct type of sling and hoist to be used for the patient. Here we have a general universal sling design made of a mesh material with padded legs. This type of product would normally be used in a bathing scenario. However, for demonstration purposes, we're using this design only. If the patient requires specific materials such as pressure relieving type materials of black spacer or parasilk material for reducing shear and friction application, these materials can also be requested at time of order. The clinician should be responsible for identifying, along with the company's expertise and guidance, as to what material is available for certain clinical applications. If the patient has some upper body support, then please ask the user to lean forward and slip the sling behind the back in an upright position as shown. Ensure the patient is supported at all times if the patient does not have appropriate upper body support. Similarly, if this type of patient and its challenges are encountered, then consideration of two carer assembly and application should be used in this instance. The sling leg sections are being passed underneath each of the limbs appropriately, ensuring that the individual helps wherever possible, and if that's not the case, apply as comfortably as you can and as safely as you can, taking consideration with your own back. The loop section is then applied through the modesty loop as shown. The modesty loop is used to keep the slings and the patient in a dignified position during lift. Only use a loop fitting sling on a loop type spreader bar. Do not use a loop sling as shown in the video on a clip stud spreader bar, and vice versa. Do not use a clip stud on a loop type spreader bar. We then apply the mobile hoist with the legs open towards the chair as shown, taking care not to hit the patient in the face with the spreader bar. Then we apply the relevant loop fitting as required for the lift as shown, taking care to ensure that the same size loop fittings and same colour in this instance are applied accordingly for an upright lift. The rule of thumb is short shoulder, long leg application for an upright lift. There may be some clinical conditions that require alternative loop application on either side. However, please contact your local occupational therapist or clinician for guidance during this process only. Once the sling is applied appropriately, please take the weight of the sling of all loops and conduct a final inspection as shown, making sure that all loop sections are applied on the spreader bar as shown. Then continue to lift the patient, communicating with the patient, ensuring that they are comfortable during the lift at all times. Ensure adequate clearance is achieved, and then remove the patient as shown in the video via the mobile hoist. Steady the patient as required. If knee clearance is not achieved, then tilt the patient sidewards as shown. Then reverse the operation when going back into the seated position. Align the patient up to the chair, still communicating. Apply just in front of the chair. The size of the boom will be relevant to the application into the chair, so do not apply the patient fully back, but lower and allow the boom to do the work as shown. Safely lower the patient until the straps are loose and remove the straps accordingly as shown. Remove the hoist and reverse the application of the sling accordingly. Ask the patient to lean forward, supporting at all times. Remove the sling and the moving and handling equipment accordingly. Should you have any queries on this video, please contact Mackworth Healthcare or visit our website on www.mackworth-healthcare.com. Thank you.